What if I told you your health insurance premiums are funding political corruption? Let's expose the truth. Welcome back to our series on the health insurance industry. Today, we expose how health insurers have infiltrated the halls of power, buying politicians, rigging the system, and leaving millions of Americans to suffer under a broken healthcare system. This is not just influence. This is corruption at the highest levels. Health insurance companies and their lobbyists are among the biggest spenders in Washington, D.C. In 2023 alone, they spent over $350 million on lobbying to shape laws in their favor. Let's take a look at the top politicians on their payroll. These are just a few of the names shaping healthcare policy under the shadow of big insurance. During the 2021 Medicare Advantage reform talks, these same politicians were instrumental in watering down proposals aimed at curbing predatory billing practices. Why? Because their campaigns were bankrolled by the same companies the reforms sought to regulate. For instance, Kyrsten Sinema's opposition to expanding Medicare coincided with an influx of donations from health insurance PACs. The result? A legislative landscape where the industry thrives while everyday Americans are denied life-saving treatments. For example, data reveals that in 2022 alone, insurers denied over $60 billion worth of claims. These denials allow companies to keep premiums invested longer, generating billions in profits from stocks, bonds, and other investments. Here's how the scam works. By law, insurers can only keep 15% of premiums as profit, but by delaying and denying claims, they keep that money in investments, raking in interest and dividends that aren't capped. For instance, United Health made over $10 billion from investment income in 2022 alone, income generated from premiums that should have gone toward patient care. In 2020, when progressive lawmakers pushed for a public option, industry-backed senators like Sinema and Tester helped derail the effort, citing bipartisan concerns. These concerns weren't from voters, they were from the corporations bankrolling their campaigns. The health insurance industry has created a system where profits are protected at all costs, even if it means denying care to patients. These contributions ensure that reforms, no matter how necessary, are nearly impossible to pass. The message is clear. Politicians funded by the insurance industry are not working for you. They're working to keep their donors happy, even as Americans suffer under skyrocketing premiums and denied claims. It's time to hold these politicians accountable. We need to demand transparency in campaign financing and fight for healthcare reforms that prioritize people over profits. This system thrives on silence. Let's make some noise. Join us in the next episode as we continue to expose the dark underbelly of the healthcare industry and its stranglehold on our political system. This video is for informational purposes and aims to shed light on the pervasive corruption within the health insurance industry and its political allies.